I've been having infection, have been treating this infection all to no avail. I've taken all the medication that they've given to me, but this infection keeps on coming back to back. What should I do? Please kindly help me to share this video to so many people so that they can also learn from this video. And when you watch a video, learn to comment, share and like the video so that other people can also see the reactions. Okay, if you find yourself in this situation, you can be a man or a woman, okay, and you know that you've been treating infection back to back, and this infection is also repeating, and now you are tired of treating infection. The truth is you've been taking the wrong medication. Yes, it can be a pharmacist that prescribe it for you. It can be a doctor that prescribe the medication for you. Taking a medication for infection without doing a vaginal swab culture is not the ideal way to treat vaginal infection. When you go to a lab, request that you want to do a swab infection. Swab infection is a place whereby they will give you something that looks like cotton bud, okay? It's very long. It has like cotton bud edge. They will give it to you. They will give you a container, a cup that you should take it to the ladies. You should bend down and swab and use it to round your vagina. Okay, that discharge, then you should drop it back in the cup and cork it. When you take it back to the lab technician, they usually tell you to come back for some days, within 3 to 5 days. By this time, they will culture. They will cook. This test will pass series of tests to know the kind of infection that is actually wrong with the person. Not just to know the kind of infection, to know what to use to treat this infection. That's why when you do a proper vaginal infection test, you will see that they will write ampiclox, they will write so many antibiotics there. They will use the infection to test all of them. Okay, the one that it reacts well to, that is what they will not tell you. Okay, go to the pharmacy, tell them you want to buy this particular medicine to treat your infection. The reason why they will tell you to use this particular medicine is because they've already run tests on with all the antibiotics, and they found out that that particular one is the one that can help you to treat that infection and say bye bye to infection. And also too, the second one is not completing your medication. So many people fall into this category. When you are treating an infection, you've taken it for like 3-4 days, and that medication is supposed to last for 7 days, but by the 5th day you are feeling better and that foul smell has stopped. If it's for the men, the itching, the quack has stopped. You just say, okay, I'm better now. You just take the medication and go and drop it. Don't forget, you are treating infection. This infection will go subside because you are taking medication, and when you don't complete it, it will reinforce and come back more than the way it was when you were treating it. Later you will not say that the medication that they gave to me didn't work. It worked, but you were not patient enough to eliminate that bacteria 100%. The third one is going back to the original point. When I mean going back to the original point, you know, as a man you have infection, or as a woman you have infection, you are not treating yourself alone without carrying your partner along, without also treating your partner. When you are done treating yourself, you will not go back again and with your partner. By so doing, that infection will be going around the circle. You've treated yourself, but you did not treat your partner, and you think you are okay, you will not go back again. Or when you know fully well that your partner is also infected, you will go back again and collect it. So that infection will keep on, the kidney will also remain in your body without going. Okay, that is why I said going back to the original point. And the fourth one is the using of hard water. There are some people that you know when the water is hard, okay, and you know when the water is not hard. Water that is not hard, you feel it, there's a way it looks like. But a water that is hard, there is a way there is a way it looks like too. When you use water that is hard to wash your kpekus, okay, it can also lead to infection. Or when you start using series of soap to wash your kpekus, it can also lead to infection, because most of this soap, they use something strong in making it, which these things that they use in making this hard soap is not supposed to be around your vaginal area. So please, if you know you fall into this category, kindly go to a good doctor, request for a lab technician, and go for a vaginal swab so that you can eliminate this infection once and for all. Most times, if you are a woman and this infection is not properly taken care of, when it's time for you to get pregnant, okay, when this a long infection in the body can lead to a fallopian tube. You see some people now, they are married and they are finding it difficult to take in. It's as a result of a long untreated infection that has gone to block their vagina. So if you are a man watching me and you know of somebody that has this, or your wife also have it, please help me to share and send the message across to so many people. Thank you.